Thank you so much for joining today's 2020 Justice and Mental Health Collaboration Program Purpose Area 2 Orientation Webinar. My name is Allison Upton, and I'm a project manager at the Council of State Governments Justice Center. I'll be moderating today's webinar, which is hosted by our office and the U.S. Department of Justice, the Bureau of Justice Assistance, or BJA. Next slide. So to give you an overview of today's webinar, first we'll do introduction of our panelists and provide an overview of the Justice and Mental Health Collaboration Program, or JMHCP as we say for short, specifically focusing in on Purpose Area 2 as well. We'll also provide information about the technical assistance process for grantees, including the Planning and Implementation Guide. Next, we'll hear from a currently active fiscal year 18 JMHCP grantee who will share information about their grant project and experience on the ground. And toward the end of the webinar, we'll have time for some questions and answers. So just a couple of housekeeping items. Anytime during the session, you can ask a question by typing it into the chat box in the Zoom. Should be in the bottom of your screen. If you hover over, you should see the chat box function and you can type in any questions there. This includes both technical and content related questions. If you have any technical issues, hopefully you won't, but we will try our best to help you with that. But certainly any content related questions, we're going to keep a running list and address them at the end of the webinar because we have a lot that we want to cover today. So we'll do our best to get through as many questions as possible. And also just wanted to let you all know that we are recording the webinar. Today we're going to be minimizing the thumbnail videos though, so your photos won't appear on it, but we're recording the webinar content, so we'll be able to send a link of the recording out to everyone that's attending today, all the teams, and also send along the slide deck as well, so you can have that for your reference. Okay? All right, next slide. Oh. There we go. So for introductions, our first presenter is Maria Fryer. She is a policy advisor for the U.S. Department of Justice, the Bureau of Justice Assistance. She oversees the Justice and Mental Health portfolio and collaborates with the CSG Justice Center to assist states, local government and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to help create policy and programming that meets the needs of the municipalities and the citizens they serve. Fryer previously worked at the North Carolina Governor's Crime Commission, where she advised the governor's office on effectively addressing the needs of victims of violent crimes. In addition to working with families overcoming violence and instability in Coffee County, Alabama, Fryer has worked in community corrections in Fayetteville, North Carolina, helping to develop intermediate and community-based sanctions for repeat offenders with drug addiction. She also served in the United States Army as a member of the Military Police Corps. Our next speaker is Matt Corin, and this is Matt is part of our grantee presenter team. He's the Director of Special Projects and Strategic Initiatives at Allegheny Health Choices Incorporated, and his professional experience includes both direct support to people in the community, as well as improving the complex organizational and informational systems that are needed to effectively deliver services to help people in their recovery. Matt's interests lie in improving systems of care and human services, including the overlap of these services with the criminal justice system. He has managed local, state, and federal grants and served as the project coordinator for Beaver County, Pennsylvania, where he's working out of, for Beaver County's initial sequential intercept model mapping strategic planning. Currently, Matt is a project coordinator for multiple federal grants, including the JMHCP grant I mentioned, that seek to expand and enhance Beaver County's behavioral health diversion options throughout the sequential intercepts and system of care. As a certified trainer in mental health first aid, Matt is dedicated to improving community awareness of mental illness for both adults and youth. Our next speaker will be Demetrius Thomas. He is the Deputy Program Director of Behavioral Health here at our office, the Council of State Governments Justice Center, where he oversees the Justice and Mental Health Collaboration Program, technical training and assistance to grantees. Prior to joining the Justice Center, Demetrius worked at the New York City Department of Health and Mental Hygiene, where he led several initiatives at the intersection of criminal justice and behavioral health, including establishing the city's first ever diversion centers, co-response, and mobile crisis teams. Next slide. Great, so we're also really excited for you all to meet the Purpose Area 2 Technical Assistance Coach team. So I'll let them introduce themselves. Hadley, do you want to start us off?
Good morning or good afternoon, depending on where you are in the country. Thank you, Allison. My name is Hadley Fitzgerald, and I'm really happy to be here and looking forward to meeting you all. And I'll be working with several of you on your grant projects. You might have noticed that I shot you an email last week to get our first TA call scheduled. So just so happy that you could make it today. A little bit of background about myself, and I'm sure we'll get to know each other a lot more in the months to come. But my background before coming to the Justice Center about a year and a half ago is as a social worker here in New York City. I worked at the Brooklyn Public Defender's Office, and then similar to Demetrius, I also worked on the collaboration of the New York City Health Department with the New York City Police Department on their first co-responder program. I was one of the clinicians on that program working directly with the police, which was wonderful. And then my final position was actually in a policy position where I brought together stakeholders across the board who are connected to the Medicaid program in New York State, and we sorted out a lot of the Medicaid reforms that were happening, the redesign that was happening in New York to, sort of troubleshoot, problem solve, and deliver recommendations to the state on how to improve that program for behavioral health services and people receiving those services. So that's just a little bit about me, and like I said, looking forward to working with you all.
Okay, should I just hop in here?
Yes.
Hey everybody, Marilyn Leake here, a senior policy analyst also here at the Justice Center. Like Hadley, I'll be working with a few of your Purpose Area 2 grants, very much looking forward to it. A little bit about me. So I've been here at the Justice Center for about 3 years, working, doing technical assistance for a number of JMHCP grants, also working with the Stepping Up initiative, which I know some of you are familiar with. My background, like Hadley, I'm also a social worker by training, but most recently before coming to the Justice Center, I actually ran a mental health and drug court program. So my background is really on the court side of things. So yeah, really looking forward to working with everybody.
Great, thank you all for joining the webinar. We really appreciate it today. And we can go to the next slide. Excuse me. So I'm just going to give some brief background on the Council of State Governments Justice Center now. The Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all 3 branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and try to strengthen communities. Next slide. So this slide describes a little bit more about our work style and how we strive to reflect, Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research. We really strive to promote collaboration and build consensus. And we always try to be as inclusive and respectful of diverse views and experiences as possible. So now I'll turn things over to Maria Fryer from the Bureau of Justice Assistance to tell us a little bit about her organization. Maria?
Great. Thank you, Allison. Welcome, everyone. Many of you are familiar with the Bureau of Justice Assistance. You may have had funding through the Bureau of Justice Assistance in the past. A little bit about BJA. We provide assistance, as you know, to states, tribes, and local communities through grant programs and technical assistance. And our goal is to reduce and prevent crime and violence, as well as improve process within the criminal justice system. And BJA supports coordination and cooperation between different levels of government and hoping to improve system-wide collaboration. And of course, we also make benefits available to law enforcement. Thank you. I'm going to turn it over to Demetrius now. Is it back to Allison?
No, I think it is to me.
It is.
Right. Yes.
Okay.
So you all are familiar with this. We don't want to spend much time on this. You heard this same spiel for your second and first orientations, and we want to spend much of this time to give you to hear from, your fellow cohort and really focusing on this grant-specific work. But really quickly, since its inception, including your fiscal 20 cohort, JMHCP TTA has had 568 awardees, representing 49 states and 2 U.S. territories, including American Samoa and Guam, which are represented in the map below or beside, which includes funding for over $164 million. Next slide. All awardees will work under a 2-phase process. The first is planning and the second is implementation. The planning phase can take up to 12 months. During this phase, you will work with your TA coaches, which you'll learn more about, which are Hadley and Maryland, to complete your respective purpose areas planning and implementation guide, which we call the P&I Guide, which will be discussed later. You can have up to $100,000 spent toward your planning phase. Once BJA and the TA coach has approved your P&I guide, you will then move to the implementation phase of your grant. The implementation phase and the complete performance period of your grant is 36 months, so 3 years. Next slide. And I just explained that. So next slide. All right, so in addition to the grantee or the grant that the solicitation provided, there were 3 purpose areas. In addition to your purpose area, there were 2 others. The first purpose area was one that focused on embedding clinicians in the law enforcement agency. Under this purpose area, it would allow for social workers and or mental health professionals to be placed in law enforcement agencies to assist officers during encounters with people in mental health crisis. Next slide. The second purpose area, which is purpose area 3, focused on mitigating threats of targeted violence. That specific area focuses on, so it will support law enforcement and prosecutors to respond to and mitigate threats of targeted violence. So now I believe I'm going to kick it over back to Allison, who's going to give us more detailed and lead us through a more detailed conversation on purpose area 2, your specific purpose area.
Great, thank you, Demetrius. That's true. We're going to go into purpose area 2 more specifically now, and we're also going to, very excited to have time for grantee team introductions today. So just we can advance one slide. Great, thank you, Marilyn. So to start with, Purpose Area 2 specifically supports mental health centers who are providing assistance and services to people with severe mental health needs who are also at risk for recidivism. So these centers may provide really a variety of services, including crisis care, residential treatment, outpatient mental health, primary care services, and community reentry supports. All of you in this cohort for Purpose Area 2 are either developing a crisis center or a diversion center, or you're also working with a behavioral health partner who's providing services directly to your participants. So this purpose area is geared towards supporting all of those activities. Next slide. So as you can see from this slide, there are a variety of activities that can be funded through the JMHCP, and we do see that represented in Purpose Area 2. So you could be trying to make connections to behavioral health treatment for your participants. You could be developing a courts program, specialized court program. You could be providing training on how to best respond to people with mental illness or co-occurring mental illness and substance use disorders in your jurisdiction. Or there could also be projects that support state and local government collaboration to serve the same target population. Next slide. Okay, so we're going to switch gears just a little bit now and take some time for each of the grantee teams to introduce themselves. So we have a total of 9 grantees in the cohort this year in Purpose Area 2, so it's very exciting. We actually have the time to really, I think, get to know each other over the course of the year. So as you can see on this slide and also the next slide when we get to it, we've listed all the grantees in your cohort. And you know, as you can see, you represent really a mix of rural, suburban, and urban areas all across the country. And so what we thought would be great to do is to do just a quick roll call of teams in alphabetical order for introductions. So we'll go through each awardee and just have the chance to at least see who's on the call today. In the interest of time, we have a lot to cover today, so I'll just ask that if you have more than 2 people from your team represented, which I know some people do, if you can just maybe select one person to be your spokesperson and then just briefly introduce each of the team members. We'd like you to, as you can see, we've included a focus summary sort of the focus for each of your grant funded work. And so we'd just love if you could please briefly introduce yourselves and your team members, if there are additional ones, and your role in your grant work. So why don't we get started? We'll start off first alphabetically. We'll go with Alamance County, North Carolina, and we just ask if you could unmute yourself. And is there someone on the line from Alamance County who could be a spokesperson?
Yeah, hi, I'm Rebecca Carlson, so I'll be the spokesperson for Alamance. I have 4 people on the call with me.
Welcome.
Yeah, so excited to be here. So I'm the project coordinator for this grant, the grant administrator. And so, you know, as it says on the slide, we're focusing on expanding our diversion center and then doing a peer support specialist in the jail for some reentry support. So with me today, I have Linda Allison and Gary Ander. They're our Stepping Up coordinators and with the Sheriff's Department. And then I also have Sarah Huffman and Amy Griffith, and they are both with our behavioral health partner.
Wonderful. Thank you so much to all of you for joining us today. And thanks also for bringing up Stepping Up, because that's an important initiative many of our grantees are also working on. So thank you. Welcome. Great. And we'll move along to Boulder County, Colorado. Is anyone on the line from Boulder County? Don't forget to unmute yourself. Just checking, because I know that they responded they were going to be here, so I'm hoping there's no technical issues. Anyone from Boulder County? Okay, Hadley, I believe that's one of your grantees. Am I correct?
That's right.
Do you see it? Well, why don't we'll move on, and maybe you can double check if anyone seems to be here, and we can come back to Boulder County if that makes sense.
Sure.
Okay, great. So we'll circle back to Boulder County. Next up is Lake County, Illinois. Are there folks from Lake County on the line? Don't forget to unmute.
Hi, it's Donna Jo Mackey from Lake County. We have 4 of us on. We have Jana Phillip from our state's attorney's office, who is our lead agency. We have Vicki Tello and Bruce Johnson, the Chief Executive Officer of NICASA Behavioral Health Services, our partner on the line. And I work for our county administrator, and I'm also the MacArthur Grant Project Director as a partner with this project.
Wow, wonderful. So you're busy. It's the bottom line. So that's great. Thank you so much to all of you for joining. And, you know, again, glad to hear about the MacArthur County work, you know, other important work as well. So, and I'm wondering if anyone else in the cohort is doing that too. So we'll find out. So thank you so much. We're really glad to have you all. Okay, and next we will go to Dallas County, Texas.
Good morning. This is Julie Turnbull, and I'm the Chief of the Restorative Justice Division at the Dallas County DA's office. I also have Marcia Edwards on the line, who is our Director of Special Programs, and we're working on our, here it's listed as a Law Enforcement Diversion Center. We're calling it a Deflection Center.
Okay.
Dallas Deflects. Thank you.
Dallas deflects. That's a great catchphrase. Great. Well, thank you so much. We're really glad that you're able to join today. And I believe might be your first JMHCP grant. So congratulations to everyone, but very glad to have you on. And we'll remember Dallas deflects as your as your catchphrase. So thank you for joining us today. We're looking forward to working with you. Next is Hancock County, Ohio.
Good afternoon, everyone. I'm Precious Stubbe. I'm the Director of the Alcohol, Drug Addiction, and Mental Health Services Board. And with me today is Jennifer Swartzlander, our Deputy Director. And we too are working on crisis stabilization services.
Wonderful. We really have, quite a group that's working on crisis stabilization and diversion deflection centers. So that's going to be, I think, it's just great to see that theme in this cohort, and you all, I'm sure, will be a good support to each other as well. So excited about that. Thank you for joining. Okay, next up we have Mobile Police Department, Mobile, Alabama. Are you all on the line?
Yes, we're here. My name is Tiffany Levy, and I work in the Grants Administration for the City of Mobile. So I'll be handling the compliance portion of the grant. Joining us on the call is Dr. Cindy Gibson from the AltaPoint Health, which is our partner on the grant. AltaPoint is our local community mental health and substance abuse provider.
Wonderful. Well, thanks to both of you for joining, and it's great to see that you as the administrative point of contact is joining as well. There's a lot of details to learn regarding managing JMHCP grants. You may be familiar with them already, but it's always great to have someone in your role on the orientation webinar. So we appreciate that. Thank you.
Thank you.
Okay, next up I think is San Francisco Adult Probation Division in California.
Good morning, all. My name's Tanya Jones. I work in the finance department, and contracts and grants fall under my very, very big umbrella. I will be the point of contact for this particular grant, which will be supporting transitional housing, and we have secured a case management treatment services within the facility. So I'm very excited.
Well, that's very exciting. Thank you for joining us today. And, it's great to hear that you're doing work around housing. I think that's one of the #1 challenges that we hear from grantees across the country. It's just, it's always a challenge. So great to see that you're going to be working on that specifically through this grant. So welcome. We look forward to working with you.
Thank you.
Okay. And next we have Seminole County, Florida. Is there anyone on the line from Seminole County?
Hi, I'm Amanda Hamer. I'll be the project coordinator from the county's perspective in our court administration, as well as our county budget and finance office. On our call, we also have our grant administrator, George Woodring, and our service providers, Marissa Gore and Catherine Schroeder, as well as our court administrator, Nicole McMillan, who helps oversee, or the court problem-solving court administrator, manager. And we will be looking at expanding and increasing our services for our mental health court. It's currently in existence, but it hasn't had a lot of support in doing initial assessments, as well as doing an evaluation on it, and really strengthening case management within the court system for it and following up on what's going on there.
Great, thank you. So it sounds like you're looking forward to kind of digging into some of those issues through your grant project now.
Definitely.
Wonderful. Well, we've worked with a lot of other grantees focused on mental health court. So I'm sure, again, there's people within this cohort. There might be prior grantees as well that you could connect with in terms of, working on those issues. So we, welcome you, and we're glad you're able to bring your team here today.
Thank you.
Okay, and last but certainly not least is the Supreme Court of the State of New Mexico. Are you on the line today?
Yeah, good morning. This is Scott Patterson. I'm the statewide behavioral health manager for the court system. Wonderful. And other person from our team today is Melissa Lovato, and she's in our finance administration department. And we are working on establishing multidisciplinary teams in all 33 counties in our state. We are a high rural, high mental health, high substance use state. And so we're working on coming up with trauma-informed responses that are meaningful for each community and really reflect the rural nature and the maybe not lack of resources, but the need to be creative in resource management.
Wonderful. Well, welcome. We're really looking forward to working with you. I think your grant project, from reading the proposals, is so interesting at the state level. And I think that some of the other resources we're going to be providing for Purpose Area 2, specifically like the learning community and some of our consultations, certainly will be applicable to everyone, but some of the topics that you just mentioned are really in sync with those resources. So hopefully they will be really helpful to you as well. So welcome. We're glad to meet you. And unfortunately, I don't think we checked back in on Boulder, and I don't think they are here today. I'll give them one last, maybe they had a last minute conflict, but Boulder, are you on the line? Okay, I think hopefully we'll meet Boulder on our next get together in the learning communities, but we'll move on for now and just say, I just want to say congratulations to all of you for your awards. It was a competitive year. And, so congratulations, and we really look forward to working with you. Okay, so, I just say, like, in reviewing the proposal materials that we have, the initial proposal materials, it really, struck me that there certainly are a variety of projects, and probably you could see that in looking at the slides listing all of the different summaries of the project work. There's a variety of projects that have been funded this year under Purpose Area 2, from law enforcement, diversion and deflection centers, to training, to court projects, to even to probation-led reentry and housing work. So each of you is doing some really interesting and innovative work, and we look forward to learning more about your projects as we go forward in the grant period. And I think your proposals also really highlighted this importance of behavioral health and criminal justice system partnerships. It's really clear that I think strong collaboration and communication is going to be key component of your projects and moving your projects forward. And also what I noticed is that this year's Purpose Area 2 grantees really span, all points of intercept in the criminal justice system, from, early pre-arrest diversion all the way through to reentry for people with mental illness or co-occurring disorders. Next slide. So with this, because of this sort of reach and breadth of your grant projects, I just wanted to quickly today highlight a CSG Justice Center resource that might be helpful to you in your work. So this resource is called Behavioral Health Diversion Interventions, and what it does is describe the key components to developing a systems-wide diversion strategy, and some of you are already started on this process. It really focuses on the fundamental agencies within either the behavioral health or criminal justice systems that can take the lead on diversion, with the goal of diverting people with mental illness or co-occurring disorders into community-based treatment and support services. So we hope when you have the chance that you'll take a look at this resource. We provided the link here for you to access in the slide deck, or you can always, of course, reach out to your TA coach. We can forward the resource to you. It's on our Justice Center website, and it's free to access at any time. Next slide. Okay, so now we're going to switch gears a bit and spend some time discussing the technical assistance process, or TA process for short, for the Purpose Area 2 grant teams. And I'm also going to provide you with more information on the planning and implementation guide, content and processes. Next slide. Okay, so the Council of State Governments Justice Center is the training and technical assistance provider, or TA provider for short, for 2020 JMHCP grantees. And as a Purpose Area 2 grantee, you're going to have a variety of training and technical assistance components available to your team throughout the entire active cycle of your grant. So you'll have a TA coach who will be your main point of contact for technical assistance. You will have access to peer learning opportunities, including connection to current and past grantees who may be doing similar work or may have faced similar challenges. You'll also have the opportunity to participate in learning communities with other grantees, as I mentioned, and I'll tell you more about that shortly. You will have access to a variety of tools to assist with your project, including resources about best practices, training opportunities offered by BJA, by the Justice Center, or by other key partners. And, you know, just as a reminder, if you might hear me saying this a couple times, but it's just really important to remember that if your team is interested in obtaining resources on any given topic, we really encourage you to approach our your TA coach to assist with this. You'll also have access to experts throughout the life of your grant cycle. You'll have access to the TA coaches, to the other Justice Center staff, our colleagues that we have in our office, who have a variety of areas of expertise. And you'll also might have the opportunity to connect with consultants. Well, you certainly will through the learning community, but even additional access to consultants who offer really a wide range of content knowledge that we'll bring all this to the table to help assist you in your work. So your TA coaches will be looking out for opportunities to connect you with these experts to support your work. Next slide. And as you can see from this next slide, your TA coach is kind of like a central hub, or almost like an air traffic controller for your team, to really connect you to resources, to activities that will support the planning and implementation of your Purpose Area 2 grant project. So throughout the entire grant cycle, each team can expect to have monthly calls with your TA coach, and early in the planning phase, you will be working intensively on what's called the Planning and Implementation Guide, or the P&I Guide, which we call it for short, which is a grant requirement to complete. We strive to be strive to be as individualized as possible through the TA process, so that your technical assistance might contain some or even all of the components that are shown in this graphic on the slide. So for example, if it fits your grant needs, you might have a combination of peer learning, resources, monthly TA calls, and even a virtual or in-person site visit when we get back to that. You might have some combination of those, or all of those be a part of your JMHCP Purpose Area 2 technical assistance process. Your TA coach will try to be as responsive as possible to each grantee team's unique needs, and to support you in meeting your project goals, as well as completing the grant requirements. So next, if we go to the next slide, I'm going to provide some more detailed information about P&I guides, TA plans, and learning communities, since these are always really popular topics with the grantees. So to start with, the P&I guide, excuse me. So the CSG Justice Center has prepared the P&I guide to support grantees in developing and refining their justice and mental health initiatives to help improve outcomes for people in the criminal justice system who have mental illnesses or co-occurring disorders. This is the target population we're working with in Purpose Area 2. So this guide is not intended to serve as a step-by-step blueprint, but rather to help your team foster discussion on best practices, identify considerations for your collaborative efforts, and help you work through key decisions and take on implementation challenges. Next slide. The P&I Guide was definitely developed as a tool for grantees for your planning process, but it also serves as a really important mechanism for your TA coach to understand more about the status and progress of your project, the types of challenges you're encountering, and the ways we might be most helpful to you in making your project, helping to make your project successful. So you and your TA coach will use your responses to the self-assessment P&I Guide to collaboratively develop priorities to focus on during the technical assistance process. So to create what we call a technical assistance plan, or a TA plan for short. So more on TA plans in a little bit. Next slide. But continuing on with the Planning and Implementation Guide, the P&I Guide is divided into 7 topical sections, each with questions, exercises, and discussion prompts. Excuse me, a lot of talking, have to have some sips of water there in between. The self-assessment questions and exercises are built on evidence-based principles and emerging practices. So for each exercise, you'll be prompted to write short responses, to attach relevant documents, and complete exercises, brief exercises for each section. Your answers will provide insight into your initiative's strengths and also identify areas for improvement. And discussion of the P&I Guide sections is really a primary focus of TA calls during the planning phase. And again, your TA coach is there as a resource to help support your planning processes. So typically, the way it goes is that grant teams collaborate across agencies to complete sections of the guide. It's not meant to be done in isolation. It's meant to be sort of a shared activity. And then, so grantee teams complete sections of the guide, and then they send it to their TA coach for review and discussion on the call itself to work through questions or any challenges, any suggested revisions, etc. So sometimes other teams prefer to complete like a full draft, a draft of the full guide, you know, completely, and then send it to their TA coach for review and discussion on calls. Either strategy is fine. It's whatever works best for your team. And so your TA coach will be flexible with you as you set up a structure and schedule for the planning process. Work through the P&I Guide sections is that your TA coach may also send you additional information on specific topics to complement certain sections. So for example, let's say you go through a section that has just a few questions on housing and you'd really like to have more information on that topic. If you would like any additional information or resources on any particular topic that's covered, please feel free to reach out to your TA coach, let them know, and they can assist you with sending supplementary information. Okay, next slide. Okay, so just a few more details on the guide content. As I said, the P&I Guide has 7 different sections, and I'll just touch briefly on each of the 7 sections. And of course, you'll see this in the document itself. Your TA coaches will be sending it to you fairly soon if they haven't already. Okay, so section 1 focuses on goals of the project. It's pretty brief, and it allows the team to enter also basic contact information about their key partners and indicate whether there have been any significant changes in the grant project since the time when the proposal was first submitted. So this could include key staffing changes or changes about your scope, or it could also include possibly challenges secondary to the pandemic. So this allows you an opportunity to describe those if they're significant. Section 2 focuses on the development of collaborative partnerships, inviting the team to consider, which key partners and stakeholders are really critical to to your initiative and to the needs of the participants that you're going to serve. So which, teams can ask themselves questions like which partners are already at the table, which stakeholders will need additional outreach to engage, and who will take the lead on that outreach. So that's what this section 2 focuses on. Teams also will look in this section at the information sharing processes that will be needed between partners and stakeholders. Okay, next slide. No, pardon me, stay on that, sorry, we can stay on that slide. Section 3 includes questions and activities related to defining the target population in your particular grant program or services. So in this section, teams will also state the number of people they propose to serve through their grant trainings and interventions, and or the number of sessions they plan to provide, et cetera, those sorts of key milestones. It's BJA's expectation and our expectation as well that each team will reach these milestones successfully. And just as a reminder, your TA coach is there to help support you in monitoring and achieving these goals. Section 3 also covers, not just yet, if we can go. Section 3 also covers any screening and assessment processes, behavioral health and criminogenic risk screening and assessment processes used during your project. It covers it in a lot of detail. And this piece of the section really assists teams to set up practices early on to make sure that their screening and assessment instruments continue to be used with fidelity over time. Okay, next slide. So section 4, the next section, focuses on identifying evidence-based services and supports. And this is really an exciting section because it really gets to the meat, the main piece of the services and interventions and the trainings that you're providing through your grant project work in Purpose Area 2. So here, teams will list the services, interventions, and trainings to be provided with an emphasis on evidence-based and promising practices. In this section, you'll also work through questions related to participant engagement strategies, as well as the length of time you expect participants will receive services from or stay enrolled in your program. There's also some questions covering the topics of healthcare coverage and other public benefits, as well as housing included in section 4. And as the name suggests, in section 5, section 5 covers data collection and evaluation processes. The JMHCP really has a strong emphasis on data collection and analysis, really encourages the use of data to help inform and drive your work. So on Purpose Area 2 projects, teams will typically collect data for a variety of purposes, including keeping track of participants and program or training activities and measuring the grant program's performance. Many awardees might conduct a process and/or an outcome evaluation so that they can gauge whether the grant program is operating as intended and having the intended results. But overall, the questions in section 5 really get at helping teams determine what data points and outcomes might be most useful to consider, and then for their grant project, and then to develop strategies to collect, manage, and analyze this data. So if you have an evaluation partner, either an internal or an external one that's working with you on your grant project, they can most likely be really a key resource as you work through this section 5 of your guide. In addition, your TA coach can also connect you to other grantees who are doing similar work for peer learning on this topic, or they can also provide you examples of past program evaluations if that's going to be helpful. Next, section 6 of the guide focuses on the topic of sustainability. So sustainability, I'm sure I'm not telling you all anything new, but sustainability of grant-funded services after the grant cycle has ended can certainly be a challenge. But starting to address this challenge earlier rather than later in your grant process offers you a tremendous advantage, which is the advantage of time, right? So starting earlier gives you time to figure out what your funding options are, where are your funding streams located, and outreach to stakeholders that may be connected to those funding streams. It gives you time to plan your data collection processes in advance so that you start early on to collect data that might be of interest to funding sources, right? People who are controlling the funding sources and who might want to see certain types of data in order to demonstrate the success of your project. And it also gives you just a lot of time, more time in general, to promote your initiative and its positive outcomes. So discussing sustainability is a key activity we really emphasize to begin early in the planning phase, and then also continue working on. Just keep it as an active agenda item as best you can throughout the implementation process of the grant to give yourself that full advantage. As far as sustainability, grantees also, our previous grantees have come up with a number of creative solutions for helping with their own sustainability, involving local media, involving social media, involving individuals who have actually become champions of their project work. So we're happy to share more about those creative ideas, and you also, I'm sure, will probably come up with some of your own that best fit with your jurisdiction. And so, it's just a really important topic to stay focused on. Okay, and last but not least, we have section 7 of the P&I Guide, which focuses on the Technical Assistance Plan, or TA plan for short. So after you complete the first 6 sections of the P&I Guide, we're asking each team to really reflect back on their planning processes and identify program development, implementation areas, or even topics of interest where you might be interested in additional technical assistance. This section also asks that you consider any challenges that you anticipate facing during the implementation processes. And I also always like to focus for a minute on the challenges, because we want all of you as teams to feel comfortable to discuss the challenges that you're facing with your TA coach. That's really critical to the process. You all probably, again, I'm probably not telling you all anything new, but every new project has its challenges, its bumps in the roads, and through your thorough planning, you'll hopefully minimize those. But inevitably, most teams have some challenges they face, and we want you to discuss these during the TA process so that we can work through them with you and figure out ways to brainstorm or address these challenges. So please, hopefully you feel free to discuss them on your TA calls. In section 7, we also ask you to share any unique aspects or achievements of your project that you'd like us to know about, right? So you may have some new or interesting or different strategies that you're applying, and we'd love to hear about those as well. We're always looking to highlight the great work that you all are doing. So I think, this information that you fill in, this brief information that you fill in section 7 at the end of your planning process will really be most helpful for you and your TA coach to then work together on TA calls to create a full technical assistance plan or TA plan. You'll develop that over the course of your next TA calls after you're done with the guide. And yeah, and so that will take place after the development of the TA plan will take place after your completion of your P&I guide. Okay, next slide. Okay, so as far as your TA plans, just a few more points. So as you're working on the TA plan, the full TA plan, you all as teams might come up with goals that you want to work on. Some of them might just come naturally out of the P&I guide process, and your TA coach might also identify some areas that they think would be good goals to work on in the TA process or resources that they'd like to connect you to, etc. So regardless of whatever way the goals and the needs arise, again, the important point I want to emphasize is that there's discussion happening on the TA calls about the needs and goals of the project, and that then you all use this information to create this roadmap of sorts, or the TA plan, which will be really a helpful tool to move the grant project forward to achieve its intended objectives. So the TA plans will be developed collaboratively, reviewed quarterly, and then updated as needed every 6 months. Your TA coach will be working on this schedule, so you don't need to remember all those details. They'll share that with you. And then every 6 months, the TA plans will be shared also with BJA. So TA plans are just another pathway that we really use to try to make technical assistance as individualized and responsive and helpful as possible to you all. So we're really looking forward to working with you and hearing your feedback on this process, as we're always trying to, to improve our processes and make them as helpful to you all as possible. Next slide. All right, so next I'd like to just provide you with an overview of a couple of additional resources that they alluded to earlier that are available to you as a JMHCP grantee overall, and also some that are available to you specifically as a Purpose Area 2 grantee. So the first resource that I mentioned is our learning communities, our fiscal year 20 learning communities that are going to be happening over the next year. And these learning communities are smaller, more intimate training events that we hold on various topics, which provide grantees the opportunity, first of all, to connect with a national expert, which is a great experience. And also, just as great, is to have the opportunity to connect to the other grantees who are in attendance in the webinar. Consistently, our grantees tell us that connection with the other grantees is one of their most important and helpful activities that they do over the life of their grant. So these learning communities really provide you with that opportunity. So as you can see on this slide, BJA and the CSG Justice Center is going to be hosting we'll be hosting 5 different learning communities in conjunction with national experts in the field over the next year. So the first 3 learning communities on this slide are indicate that each of the 3 purpose areas 1, 2, and 3, will have their own learning community just for their own cohort. These are grant required learning communities, so you all will be attending, of course, the Purpose Area 2 learning community, which I'll tell you more about in a minute. So these are closed learning communities just for the cohort of grantees that received each of these Purpose Area awards. So just quickly, I'll tell you Purpose Area 1 is doing their learning community in partnership with the National Police Foundation and the American Association of Prosecuting Attorneys. Purpose Area 2, our purpose area, I'm really excited to let you know that we'll be partnering with the National Council for Behavioral Health, for our learning community. It's just going to be really exciting and helpful, I think. We're going to be providing specialized training and assistance to mental health, to diversion and deflection centers, to our behavioral health partners, all the support in working with this high risk and high behavioral health need population that we're aiming to work with. So I'll tell you a little bit more about the Purpose Area 2 learning community in a minute. Purpose Area 3, in their learning community, specific learning community, will be partnered with the Institute for Intergovernmental Research and also with the American Association of Prosecuting Attorneys. So the first three are Purpose Area specific. You all will be attending the Purpose Area 2 learning community. Then the learning communities that are listed here in numbers 4 and 5 are actually have a broader attendance. So they are most likely going to be open to all JMHCP active grantees. Certainly you all will be invited to attend these learning communities listed in 4 and 5 for sure. So a little bit of more information about them, and we hope you're interested. They are not required, but they're a great opportunity, so we'll hope you'll be interested in participating. Number 4, the high utilizers learning community. This is our second year running this learning community backed by popular demand. And we're doing this learning community in partnership with the IGEST Institute. And this learning community is focusing on a variety of aspects, but a lot of technical aspects in terms of data collection and tracking of individuals who you might consider to be high utilizers in your jurisdiction. So these would be individuals who are cycling through your behavioral health and criminal justice systems frequently, using a lot of resources and really going into a lot of costly locations. So frequently cycling through your jail, through your emergency housing shelters, through your inpatient behavioral health treatment, through your emergency rooms, right? I'm sure you probably, no matter how rural or how urban your, or anywhere in between your jurisdiction is, there are these individuals that are, really struggling. And so this is an opportunity to participate in this learning community, to learn some additional strategies and how to track and ultimately respond to the high utilizers in your area. So we hope you'll be interested in joining into that. We also have our 5th learning community, which is focused on data collection, information sharing, and evaluation, number 5 on the slide. And this learning community is being done in partnership with Dr. Faye Taxman out of George Mason University. And I'm not sure if folks are aware of her, but she's, not only is she a national expert, I would not hesitate to say she's probably an international expert on, the work on data collection and evaluation and quality assurance at this intersection between criminal justice and behavioral health systems. So this is another great opportunity. This learning community has been quite popular. It's been running for, I think this might be its 4th, maybe its 5th year that we're running it. And so it has evolved over the years. And this year, they are going to continue cultivating their learning community for project evaluators, working with all the grantee teams on a variety of topics, including the utilization of a uniform program evaluation template that they've developed. They're going to be working on creating data linkages across these systems and really supporting the development of quality assurance processes for the grant teams. So again, I think this is going to be a really great opportunity if your evaluators on your project are interested in attending. We'd love to have you join into that learning community if possible. Okay, next slide. So just a couple of more quick points about our Purpose Area 2 learning community, which again, I think we're really excited about. As I mentioned, and I've hyperlinked, the lighter blue on this slide are hyperlinks, so when you get the slide, you can just zip right to these topics, or certainly you can just Google them on your own. But our Purpose Area 2 learning community, again, we're partnering with the National Council for Behavioral Health as our expert partner in this area. Really excited to work with them. They are going to be using what's called a Project Echo approach with grantees focused on increasing outcomes for their clients and participants in the justice system. I don't know if any of you are familiar with this, but it's a very interesting, Project Echo is a very interesting model. It's not a telemedicine model, it's what they describe as a telementoring model. So it's a model that strives to share information among participants and have significant follow-up on the information sharing and working on various outcomes. So it's a really interesting model. Actually started in New Mexico. I know we have our New Mexico grantees on the line. You all may know more about it, but this model has been used to focus on increasing health outcomes for a variety of different issues, including working with people with opioid use disorders, working on rural health outcomes, improving rural health outcomes in particular of interest, working to help peer educators achieve certain outcomes in prison system settings. So we're going to use that same model for our Purpose Area 2 learning community, which I think is going to be a really exciting experience. We're also excited just for Purpose Area 2 to offer some additional consultations through an agency called Policy Research Associates, or PRA for short. Now, and they are you may recognize them as the agency that created the sequential intercept mapping process. So, and the map. So we are, really excited to work with them as well, to be able to offer you a variety of different individual TTA consultations, possibly, depending on how many people are interested, and also some forum events, so a smaller group of grantees attending topical forums. So the areas of expertise with PRA that we're going to focus on for Purpose Area 2 are support for Intercept Zero in general, connecting with community-led involvement or community buy-in for Intercept Zero, which I think is a really topical concern at this point. And then also having them help assist around trauma-informed care. We're going to have a forum and also individual consultations around trauma-informed care across all of the intercepts. So I think those are going to be some really exciting opportunities. Our learning community activities and consultations will begin sometime in early 2021. So you'll definitely be hearing more about the specifics about upcoming events from your TA coach, dates and just other details about the activities. We'll be sharing that with you in the new year. And we're just really excited for the learning communities to begin and hope that you are going to be excited to participate as well. So next slide. So with that, with all of that, as a lot of information, I'm excited to move into the next section of our webinar today. We're really grateful to have a currently active fiscal year 18 JMHCP grantee team members here today. They're going to describe their project, share their experience and their lessons learned with us today. And so without further delay, I'll turn it over to our grantee presenter, Matt Corin, who's the Director of Special Projects and Strategic Initiatives at Allegheny Health Choices. And he and his team, I believe there are other team members here today, are from the grant team working on the fiscal year 18 JMHCP County of Beaver, Pennsylvania grantee. So I'll turn it over to you, Matt.
All right, thanks a lot, Allison.
Sure.
Yes, so like Allison mentioned, there are a few other team members on the call or the Zoom that we're doing now. Danielle Rombach is the project director. She's with Beaver County Behavioral Health. Nancy Jaquette works with the county and their grant administration. And Maria Townsend is our evaluator, independent evaluator. So I believe they're all on the call. So for the three of them, please chime in at any point if you'd like to add additional information as we have our conversation. Thank you very much for inviting us to say a few words during your orientation call. Our experience has been very positive, not just on our current JMHCP grant, but I guess before the purpose areas, there were categories. So even during our previous categories 1 and 2, our experience was very positive. So we felt very lucky to be able to get awarded a category 3, and our experience, continues to be strong. So just to give you a little bit of a background of Beaver County, Pennsylvania, the map that you see on the slide, actually the star shows Harrisburg, which is the state capital. Beaver County is on the western side of Pennsylvania, located about 30 miles away from Pittsburgh. So don't be fooled by that star. Beaver's on the left-hand side. It is an area that historically had a lot of steel mill activity, and then through the 70s and 80s, a lot of that industry went away. So there are pockets of rural and urban areas, other pockets of poverty and increased crime areas. So we have a little bit of everything thrown in. It also, the county has a number of small police departments. Upwards of 37 separate departments. Also, the state police are involved in patrolling the area. So that kind of makeup is a challenge when we're trying to coordinate program development and program implementation, across the county. Also, just another kind of key part of our area, over the last 5 years or so, Shell Oil has been constructing an ethane cracker plant, which is a massive project. For a time, it was one of the largest construction projects in the world. So throwing that into the county and then introducing a lot of the transit workforce really has put pressures on our law enforcement and social services. So we're kind of factoring all of that in as we're doing our planning. Our involvement with behavioral health and criminal justice collaboration, and really those are the two parts that I really want to focus this few minutes on, really, are our experience with the TA, who's Ethan Kelly, who's been great, and also a little bit of our experience with collaboration. Our collaboration really goes back to early 2000s in a very informal way, not kind of a system perspective, but we started working closely with Beaver County Jail and introducing some behavioral health services into the jail environment. That continued to develop. Then around 2009, 2010, we were awarded our Category 1 Strategic Planning Grant. And that really started to help put some framework around our work with criminal justice. We did sequential intercept model mapping exercise and really started to put into place the pieces that were currently in place and also identifying where our needs were. And that really has served as our roadmap ever since. And it's something that we revisit on a very frequent basis. And actually, as recently as this past, just a few months ago, we had another mapping exercise where all of that information was updated. Our current project right now really has a system focus. We are looking at the current diversion programs that we have in place and where there are opportunities to expand and enhance them. For instance, we have a diversion program at our preliminary court hearing phase, and we're looking to expand that, for instance, in the Court of Common Pleas. We're also looking at opportunities to kind of collaborate more with Category 1 Comprehensive Opioid Abuse Site-Based Program grant that was also that's currently underway in the county as well. That really addresses some of the substance use issues in the county. Beaver County had one of the highest opioid overdose rates in the nation. So that is definitely an area that we are trying to address and factor in when we do our planning and program development. So in terms of our technical support, Ethan, like I had mentioned, has been really helpful. And I suspect your experiences as you move forward with your various grants will be similar. Early on, Ethan was involved with us in helping us to complete our planning and implementation guide. we all had our proposals that had been accepted. We had our ideas of what our projects are going to be. But that exercise of completing the planning and implementation guide really does, at least it helped us to clarify and focus some of our intentions and really think through some of the details and how to operationalize some of our plans. And early on, Ethan was involved in supporting us in being a sounding board for ideas, as a resource to bounce questions off of, and he really helped us kind of clarify our direction as that plan took shape and was ultimately accepted. Like Allison had mentioned, we have been meeting with our TA coach regularly for a few years now on a monthly basis, and that ongoing contact serves as just another area to help kind of continue to drive and push things forward. He really has kind of become a part of the team in that sense. He's familiar with all of the players and people in the county, and like I said, we definitely look to him on a regular basis to be one, a very valuable resource for us. Yeah, like was mentioned in the presentation, definitely has provided access to resources, best practices, and national models. Things that we don't think about, he'll suggest. Hey, why don't I send you, this information? Some examples include a host of shared resources on pre-arrest and deflection models. Really assisted us with our research that we're going to be doing on our own anyway. So he's really been able to bring kind of a national perspective to kind of some of the things we're looking to accomplish. One of the areas that we're pursuing is a pre-arrest program, a lead program in Beaver County. And he was able to connect us with a similar program in Charleston, West Virginia. And one of the things that I remember discussing at length with Ethan was the need for us to get a comparable program. Pittsburgh's only a few miles away from Beaver County, but the scale of Pittsburgh and Beaver County are just apples and oranges, two different things. So, we had that discussion and kind of asked Ethan to look a little bit harder in trying to get something that would maybe be a little more valuable to us and a little more something that we were looking to complete. And he was able to make the connections with that program and the program director. And he didn't just make the connections. Your TA coaches, our experience has been that they go beyond just making the connection. He was really helpful in facilitating the conversation. So it's not just, hey, you really should call this person. It's let me set something up. Let me drive the meeting, facilitate the conversation, and help you kind of get as much out of that that connection as possible. Another example, and this is an area that wasn't even in our original scope, but through our discussion on a regular monthly basis, we were talking about some of the, there were a few months in the summertime in Beaver County where a few local law enforcement agencies had some deaths. A couple of chiefs had passed, and there was just some unrest, and that really spun into a discussion on the need or the value of having a more comprehensive officer wellness program. And so it really just started with a conversation about what's happening, and that has really developed into something that the county is pursuing, and that's another area where Ethan's been able to connect us with the National Police Foundation and their resources, and now we have multiple police departments who are interested, and it's really has potential of being something really useful to the county and the officers. So we're excited about that potential moving forward with it, and he's been really instrumental in helping us pull that together. From a collaborative standpoint between behavioral health and law enforcement, I think we have a long track record of that. I think a lot of it has to do with the size of Beaver County. It's big, but not too big. So you're definitely able to have solid relationships with people. It's a place where a person can pick up the phone and feel comfortable talking to a person. Our SIM mapping in 2010 really helped to solidify some of those relationships between behavioral health and criminal justice. I think that was an eye opener for a lot of the different players, in that they really had a strong understanding of those areas of overlap and different intercept points. We're very close with the Criminal Justice Advisory Board, which is a county organization. All counties in Pennsylvania have one, but it's a group of leaders within the criminal justice system. There are also community members. Behavioral health sits as a member of that board. And obviously you have the probation, district attorney's office, court administration, law enforcement's represented, sheriff's office. And for a number of years, the behavioral health administrator served as the chair of that Criminal Justice Advisory Board in Beaver County, just kind of as an example of the extent of our collaboration. So really, as I was kind of thinking about this, it looks like we've gone from just relationships to a kind of a collaborative relationship collaboration. And lately, we've really started to develop partnerships. That's kind of the next evolution of that. Recently, behavioral health services have always been involved in facilitating a critical incident stress management program for officers. And recently, a number of staff at Beaver County Behavioral Health were recruited and joined the Emergency Services Unit, the ESU in the county, and have started to really be a part of that operation. They co-train. So they're really, has taken a nice step in embedding behavioral health services into the criminal justice system. And we're really hoping to grow on that foundation as we move forward. Another area where we've done a lot of increased collaboration, and this is, we'll get down to my tips, but in areas of cross-system trainings, we've been training a mental health first aid since 2012, a number of years. And early on, we wanted to really use that curriculum and engage criminal justice staff with mixed results. But I'd say in the last few years, actually the last year or so, we've actually made some good headroads in that area. Even when we started, we had a police chief as a trainer, but that's since expanded. Now we have other first responders as trainers. We've trained the emergency services unit. We are now doing mental health first aid training in the police academy and other law enforcement departments. We also have a shared training team with behavioral health and criminal justice and trauma-informed care and criminal justice system training. We've also conducted Narcan trainings in a shared way as well. So we're definitely looking to have training teams be combined between behavioral health and criminal justice wherever possible. So some challenges, and I think that most folks are probably familiar with this. Some challenges that we've had from a collaboration standpoint. Obviously, there are different cultures, different worlds between criminal justice and behavioral health. So acknowledging that and managing that is very important. Obviously, it comes down to the different acronyms and language that's used. And it's not just understanding the culture of criminal justice. It's the criminal justice staff also understanding the world of behavioral health. So it definitely goes both ways. Informing criminal justice staff of the available services in the community. There are different degrees of mental illness. Understanding how they can refer individuals for substance use support. So that back and forth is very important. And actually, one of the trainings that we'll be focusing on in the first quarter of 2021 will be a training with the Bar Association to really help to inform a lot of the attorneys, district attorney staff, public defenders on the available resources and how to go about connecting people that you interact with those resources. Both sides, both systems have stereotypes. So just understanding that those stereotypes are just that, and working with people on a personal level as much as possible sometimes helps to address those stereotypes you might encounter. Just some tips: be respectful of each other's mission and culture. Police officers, approach situations in a certain way based on their training. Behavioral health approach situations sometimes differently, and where they can complement each other is important to understand, and how they can each add value to each other and support each other. Developing relationships, like I mentioned. Don't pretend to know each other's culture or language. Be open to learning about it. You don't want to come across as I'm not a police officer, and I don't try to be a police officer, and I lose credit and credibility if I kind of come out of my lane, so to speak. So that's just something to be aware of. Where you can, recruit and engage partners on the criminal justice side who can champion your cause or represent your project efforts to the larger system. That's very helpful. Finding areas of overlap where interests align. For instance, where you can develop the process together to streamline police involvement, time-saving areas, added support on certain types of calls, for instance. And then just in general, prioritizing cross-training as much as possible. So, yeah. Thank you.
Great. Matt, thank you so much to you and your team. We really appreciate you joining us today. It's just great to hear about your experience, and exciting to hear that that you really, sounds like you really used the TA process well to your advantage to help the grant project. And also it's exciting to hear that you've spread things out a bit. You're working on the officer wellness, and it's great to have grantees sort of take that systems view so that they can get the maximum impact, right, of their work, which is what everyone is aspiring to. So thanks so much for sharing your experience. We appreciate it. So I think we can go ahead 2 slides now. I'm not sure, Matt, if there was anything really quickly you wanted to say about this slide. I want to leave at least 10 minutes for questions, but.
No, that was just our timeline that I touched upon during the talk, so we're fine.
Great. Well, it'll be included with the slide deck, so people can take a look at it in more depth when we send that out. And so now really we'll just shift into the Q&A part of our questions and answer portion of our session. So we're going to try to respond to as many questions as we can in the time remaining before 1:30. Just as a reminder, you can chat in your questions in the chat box, in the bottom of your screens. I'm seeing already a lot of thank yous to Matt and your teams for your presentation. It was very helpful. So we're gonna take questions. You can also feel free to unmute yourself. I think we can manage that if people don't speak over each other. If you have questions, please feel free to unmute yourself as well. And while we're doing the questions and answers, we're also going to flip through the remaining slides that we have. Again, you'll get them as part of the slide deck, but we have some additional resources, references, presenter contact information, and a way that you can sign up for the CSG Justice Center newsletter if you haven't already done so, because that's a really helpful way to get information about upcoming trainings and experiences and resources too. So we'll start off with questions. I'll just open it up first. So we've gotten some questions in the chat box, which I'll get to, but is anyone on the call today want to unmute yourself. Do you have any questions you'd like to ask of any of the presenters or of Matt and his team? Don't forget to unmute yourself if you have a question. Okay, well, we have some questions that came through in the chat box, so maybe we'll start with those. But as we go through the Q&A period, let's see, we're getting some. If you'd like to unmute yourself as well, that's fine too. So our first question. Oh, okay. So I think we're getting a question about how long do the TA coaches stay working with the grantees? I hope I'm getting that question correctly. And so I can just take that one. Actually, it's actually a great resource. Everyone will have a TA coach, their TA coach working directly with them throughout the entire active grant cycle. So from now until your grant cycle officially closes out, we'll continue to work with you through planning and implementation. So I think that's the question that was being asked. If not, let us know. Okay, and the next question, maybe Maria and possibly Demetrius might be able to answer. I have some ideas, but I'd rather have Maria answer officially. So, so a question is being asked about the administrative aspects of the grant. There's a lot of details to that with reporting, with just general, the financial aspects of the grant and just the general administrative management of the grant. And so the grantees are wondering, how they can get assistance with that aspect of the grant project, since that's not the TA coach's area of expertise. Maria, would you be able to touch on that?
Right. So, yeah. Sure. Can you hear me okay? Okay.
Yes.
So, of course, there are a lot of aspects to managing a federal award, certainly. And, you can actually, you can build this in, personnel-wise, when a part-time, you FTE, just a part-time position to help administrate and manage. Just to house that person in the pilot house that keeps track of, when awards are due and when reports are due and things like that, and kind of keeping track of all those administrative deadlines. And the other way it can come into the project as in-kind, it can get built into the project through in-kind, which means that from within, the organization or from
Maria, your audio got a little bit fuzzy there for a second.
Yeah, that's been happening with Zoom. I don't. Are you able to hear it at all?
Better now, yeah.
Okay.
Yeah.
Okay, I might have to plug in a headset, but programs get very creative. I would even suggest, if you're partnering with an evaluator through a university, a graduate student. A master's social work has to put in 120 or more hours. I think the social workers can speak to that. So get creative in terms of bringing resources to your project. But it is a challenge. We ask for a lot. So any other ideas we can present. But you can use federal money. If you bring in-kind or match for administrative position, just remember it can't match federal with federal. You can match local, you can match county, you can match state, you can, but you can't match federal with federal. So good luck on that one.
And Maria, is the training process the same like for the financial, for example? Is there is there a financial training that the POCs have to go through this year, right? So that'll help.
So yes, 120 days into the grant cycle, unless that's changed, you have to go through the financial management training. So I would just suggest that you revisit our budget management webinar, which was recorded, and I'm pretty sure all that information is in there.
Yes, that's part 2 of our general orientation webinar this year. And if grantees are interested in getting a copy of that, just ask your TA coach and we'll send you a link to it. That has a lot of information. And where to go for more information.
Yeah, and Allison, in support of that, I'll actually be circulating to all of the fiscal 20 grantees the PowerPoint presentation and the recording for both webinars, orientation part 1 and orientation part 2, so that the link to that information will be included in there as well.
You'll be getting, everyone will be getting that shortly. That's great. Thank you so much, Demetrius. And Demetrius, to tag on to your answering, see what happens when you jump on now. I have another, just another question about P&I guides. When can grantees expect to, when can they expect to get the P&I guide template, and how will that happen? And
I would assume this is the same process, Allison, that it's been before. Now that grantees, now that you've made your contact with your TAs, I think your TAs will be sending the P&I guide drafts for specific purpose area 3 to you. And then starting immediately on your first call with them, you begin to discuss and build out your P&I guides.
Great. Okay, thank you so much, Demetrius. And then some other questions. We'll see what we can get in before the end of the time. And again, I'll just ask to the whole group. I've gotten some questions in chat, but does anyone have any additional questions you'd like to jump in? You can unmute yourself.
Hi, this is Gary Ander in Alamance County, North Carolina. And it was great to hear from Maria Fryer. That was my question on TA. We've gotten great content TA in our last BJA grant, but we've had issues around support on these other administrative pieces. And I'm wondering if there are go-to people, like we have here. Are there go-to people on the administrative side to take care of those kind of technical administrative issues?
So yeah, I can go ahead and take that. So I think more to your question was more about how can you get assistance on the BJA side, perhaps, with technical assistance, or if there's an issue. So the way that it works when you're managing a federal award, and I'm sure, Gary, you're familiar because you've had a JMHCP grant and you've done this for many, many years. But so before you can, on a policy issue, you can go to the policy office, you can contact me. On the post-award side, when it comes to more of the fiscal and the reporting and anything around those aspects of your project, that's going to be through the programs office. You have to contact your grant manager, Nikisha Love or Tammy Lovell. And we understand, how burdened they are. I mean, the number of grantees that they have to manage every day, it's a lot. And if they don't get back to you within a couple of days, like if you don't hear back within, 2 to 3 days at the most, then definitely reach out with your your TA coach, CC me. Oftentimes, then I will go back out, and I'll ping them again. We'll try to elevate your issue. I would also encourage you to think about, using the help desk, using all the tools that are available to you to try to figure it out, whether it's a technical issue or it's a process issue or if it's an issue on our side. But what I would most encourage you to do is to not let a problem go for 2 and 3 months, before you actually verbalize, hey, I'm having an issue. I can't get through, my report's not, whatever it may be, I just encourage you to address it as soon as you can. And if you don't get response, to elevate it and to continue to elevate it. And then if my counterparts are not responsive, and most of the time they are, but I have people that I can go to. So if, just the same goes for me on the policy side. If you don't hear from me, I have a supervisor. you know? So, I mean, we're obligated to provide customer service, and you're our customer. I will just tell you that. You all are our customers. So, we try to get to you and provide you that customer service as best we can. Oftentimes we are overwhelmed. I'll just tell you that. There's a lot more of you than there are of us. So I would ask you to be patient. But at the same time, I would not want a problem that you have on the local level to go unchecked for long periods of time. Because, you know, Allison knows, you know, if she hasn't heard from me, she'll get pesky with me, and then I get pesky with the person on my side. And between us getting really pesky and knocking on doors, we usually get it solved. So I just encourage you to, you know, be persistent in this work. And I know you all are persistent in this work because you managed to get awarded. So I'll just encourage you that way.
Thank you so much, Maria. We really appreciate that. And Marilyn, I don't know if you can just go back one slide as we end. I think you'll see, and you all will get this information. Even one more. Yeah, here's all of our contact information. You'll be getting that in the slides. And I know we're at the end of our time today. It went so quickly. So I just want to say thank you to all of our panelists, all of our presenters. Thank you so much for taking the time to join us today. And equally important, thank you to all the grantee teams for joining us. You know, we're really excited to get the chance to work with you and get to know you better. I'm sure we're going to all get to know each other and our work in more detail in the Purpose Area 2 learning community. So more information to come on that. And just thank you again. And in the meantime, have a great week. Have a great afternoon. Take care, everyone.
Thank you, Allison.
Sure. Thank you. Take care. Bye-bye.
Thank you. Thanks. Bye-bye.